Good morning, and welcome to our second session, Shared Decision Making in Medicine. My name is Zita Lim. I'm a physician assistant at MD Anderson Cancer Center, and I'm joined by three other colleagues here, Dr. Chung Han Lee as well as two of our patients, and we'll have a moment to I would like them to introduce themselves and maybe tell us a little bit about themselves as well. And then we'll talk a little bit about our session and go from there. John, why don't you start off?
Great. Hello, everyone. I'm John Farrell. I am in Austin, Texas. And I was originally diagnosed in 2010 with stage 3 kidney cancer. Had a radical nephrectomy back in 2010 and remained cancer-free for 7 years. And then I moved to stage 4 in 2017 and participated in a couple clinical trials along the way. I'm currently NED as of, I guess it was last year of 2010, April of 2020. So it's been a little over a year, and I'm under observation and go for scans every 4 months or so.
Bruce, can you also tell us a little bit about yourself, please?
Sure, thanks, Zita. Hi, everyone. I'm Bruce Hill. I'm from the Mid-Hudson Valley region of Eastern New York. My doctor is Dr. Lee, and who's here with us today. And I was diagnosed in 2017 with stage 4 kidney cancer, clear cell renal cell carcinoma, right kidney radical nephrectomy, and the metastases were in my lungs. I did have one lung surgery, and then we monitored the mets in my lungs for about a year. And then when they started to progress, we made the joint decision to start with the Opdivo and Yervoy combination therapy. And I had actually only 2 doses of that because I had autoimmune hepatitis response to that. So we had to manage that with prednisone, which worked well, but I did have to stop the treatment. The good news is, however, though, from 2018, I had pretty much a complete response, and I've been essentially no evidence of disease since then. So going on over 3 years since I've had treatment, and we continue to monitor, but it right now looks very good.
Thank you. And Dr. Lee, could you please share a little bit about yourself as well?
Hi, so I'm Dr. Chung Han Lee. I'm a medical oncologist at Memorial Sloan Kettering Cancer Center. So I focus predominantly on kidney cancer as a clinical investigator. So I not only see patients, but I do clinical trials and also translational research. I'm also on the medical steering committee for the KCA.
All right, thank you. So the reason we're gathered for this session, it's titled Shared Decision Making in Medicine. And it's basically a process whereby patients and physicians, the healthcare team, they contribute to medical decision-making process and to try to agree on the treatment decisions. So with that in mind, my question, I guess, to the panel here is, how do you understand when you hear that term? What is your understanding of shared decision making in medicine, and how do you apply it in your own practice or in your own life? Dr. Lee, would you like to kind of start that one off?
Sure. Thank you so much. So when we think about shared decision making, in many ways, this is, fairly new for medicine. I think that over the last couple decades is where this has really been implemented. So If you really think historically, medicine used to be very, very patriarchal, in which there was this doctor who just like kind of told you what was going to happen, and and you just kind of did it without really providing full explanation of what was going on. Certainly by the time I started training, we really started implementing this as a model in which the idea that patients should be full participants within their care, it was really, really integrated. And so there's still quite a bit of diversity in terms of what that means in terms of full participation, because we really do have to tailor that to the patient's own needs and wants, and also their degree of medical savviness, to make sure that we're really providing them with the type of care that they would certainly benefit the most from, and also that's consistent with kind of their own wishes.
Thank you. How about you, Bruce? As a patient, what does that mean to you, and how have you applied that in your own journey?
Yeah, thanks, Zita. So I think back to when I was first diagnosed in 2017, and as we heard earlier, it's not always now. It is not always the right thing to do to jump right into surgery and get the tumor out. Right, there may be some sort of treatment that happens prior to that, as we heard in the first session. But in 2017. It was definitely a one-way street. It was a doctor, a urologist not Dr. Lee, a different doctor, telling me, the kidney's got to come out. And that was kind of the only option. And then when we confirmed that it had metastasized to my lungs, that's when I felt I needed to get a little more involved and try to start to discover what is out there for kidney cancer today, right? And obviously in 2017, there were a lot of developments already happening. The Opdivo Yervoy combination was just about to be approved. And so for me at that point, I felt that I needed to get more involved, do my own research, do my own investigations into what are the options that are out there. And then when I did start seeing Dr. Lee, one of the first things we talked about was these are the things that are happening right now in kidney cancer research and treatment developments. And so we were able to start that communication, even though we waited a year for the treatment to start. We started that right away, and so I had information. I told Dr. Lee what I knew about, or what I had already started to look into, and I just that communication was just very beneficial to me as I started my journey with metastatic cancer.
Thank you. How about yourself, John? What's been your experience with respect to shared decision making in your journey with kidney cancer?
Sure.
How do you apply it to your experience?
Yeah, it's very similar to Bruce's story. You get the diagnosis, which is very overwhelming to begin with, and you're entering into a world of information that you don't necessarily know about, terms, etc. But when I was initially diagnosed, my urologist in Austin said, yes, you got a tumor in your right kidney. We got to take it out. I was like, wow, okay. Let me try to research this a little bit and get multiple opinions. So I went to see another specialist down in San Antonio. That doctor was like, oh, yes, yeah, it looks like kidney cancer, but I think I can do a partial. And I was like, okay, well, what does that mean? So I had to go and kind of research that, and then went and got a third opinion, which when I ended up at MD Anderson, and that my surgeon there agreed with my doctor in Austin. Yes, we got to do a radical nephrectomy. So getting those multiple information from different perspectives from different doctors certainly. And we had to make some decisions. Do we remove the whole kidney? Is it 2 out of 3 recommended to take it out? So there was some decision making there. And then for me, it was, okay, what happens after that? You know, what is, I wasn't diagnosed stage 4 initially in 2010. So a lot of it was just trying to get information, you know, okay, what happened from here? You know, what's the plan going forward? And asking from my medical team, you know, what that means. And I actually ended up participating in a clinical trial after that, an adjuvant clinical trial where they made a vaccine out of my tumor. So that kind of put me in a whole nother decision-making process to research, you know, what is clinical trials, number one, and number two, you know, what kind of effect is this going to have on me with the time commitment, et cetera. So I was kind of thrown into it pretty quickly from that perspective. And then moving forward, once I had metastasis in my lungs and my pancreas, that decision process, you know, had to come up. All right, now what, you know, with all these different therapies that are available right now, do I jump into one of those, or do I do another clinical trial? And I ended up doing another clinical trial, and I've only done clinical trials so far. Some of the drugs FDA approved, some of them not. So there was a lot of aspects that went into that. And the great thing, and also the bad thing, is there's a ton of information, right, on the internet. So it's trying to disseminate, you know, what's right, you know, other people's opinions, what other people have done. And I think the first session touched on it, is not every treatment's going to work for everybody else. So you really got to try to understand those factors with your doctor, with your medical team, and really try to decide, you know, based off of, you know, your factors, age, you know, health, which direction you're going to go, because there are certainly different therapies that will have different side effects. So.
Yeah. So, I mean, obviously both Bruce and John have had very successful outcomes, but what I've heard from both of you is that, you know, when you first embarked on this journey, it was pretty, you know, harrowing, I guess, because, you know, you are hearing different opinions and from different folks. So when you're thinking about this as a shared decision model, that's probably a harrowing part of this is deciding how do you know, who do you listen to, and how do you decide what to follow. And also, I think Dr. Lee kind of alluded to this, is this philosophy of care, and who do you connect with? How did that impact you? I mean, finding out, you know, connecting with someone, what was important to you in, you know, when you're going through these different doctors and coming, you know, developing a relationship, that philosophy of care. I don't know, John, do you want to kind of continue on that a little bit?
Sure. You know, one of the biggest things, right, was being able to have the time with the doctor. You know, the clinicians and physicians are very busy, as we all know, and, you know, having a set of questions going into your appointment, and then having your doctor being able to engage with you, to listen to you, you know, is key, right? And maybe bring other perspectives and bring up more questions that you may not have thought of. Because, you know, obviously we're not trained physicians. We don't do this every day. We are patients. And with the wealth of information that's out there, you know, for me, it was, all right, understanding kind of what my different options are, and you know, the pros and cons maybe of each, having those set of questions for my doctor ahead of time. And then once I was in my initial appointments, asking those questions of my doctor, and having them, you know, one, listen to you and be open to that discussion. You know, I've heard some cases where physicians, you know, do have, hey, this is what we're going to do, and this is what I think, and let's move forward. And you're like, well, wait a minute, you know, what about this, or what about this treatment? So, I think it's important to have establish that relationship with your doctor. Make sure they're, you know, you're going to set aside that time, and make sure that you know, sit them down and say, this is what I would like to know, and this is what research I've done. You know, help guide me through this process.
What about from a clinician standpoint, Dr. Lee? How do you how do you approach, what's your philosophy of care, and does it alter based on who the patient is, or is it something that's internal to you, and how do you approach this question, I guess?
Yeah, so I think that first off, I think one of the things that's really important is getting a sense about how much the patients want to know, and to what detail and what degree that they want to be involved. And getting also a sense of like how much research that they've already done. Like I can even remember from Bruce's like initial visit in which he had printed out copies of the NCCN guidelines and like had the entire stack there, and like had a notebook that he was taking in that had the KCA like logo on it. Like, so I remember that like distinctly from his first visit. So I knew off the bat that this was going to be a person that was wanted to be quite involved in their care. On the flip side, I've also had patients say, like, just make the decision. Just make the decision. I don't want to be involved. Just like, tell me what I need to do. But I think that even for those patients, even for a person that says, I don't want to make any medical decisions per se, I think that there's actually still quite a bit that you do make decisions about, not necessarily related to the medical care, but to try to find a provider that matches with the way that they think about their disease. That's not necessarily a medical decision, but understanding and making sure that, when you how you feel about, data or is meshes in line, and how you think about the aggressiveness that you want to do about treatment, that type of partnership is there. Because if you have a mismatch between how your doctor thinks about your disease and, how you think about your disease, that really is a situation that just leads to kind of conflict down the line, because what you're hoping to get is very different from what the doctor's recommending from their perspective, and making sure that you're both at least on the same page with regards to how that's done, I think is very critical. So I think that trying to understand the patients, where they are, what they want, is quite important. And also making sure that it's a great fit between the two of you. Because, we do certainly hope that the relationship that you have, between the patient and the physician is a long-term one. In some ways, it's like choosing who to marry with a 20-minute conversation. And I think that it is beneficial to meet and see a lot of different doctors to make sure that you actually do connect.
And Bruce, I know you're actually you're returning to us this year as a panelist on this particular session of shared decision making. But you're returning, I see, solo without your wife at your side. Last year she joined you, I understand. So I wanted to ask you, I guess, this question specifically. How does family members or caretakers, how do they fit into this? How do they participate in this decision making process? How did your wife play a role for you?
Yep. Yeah, that's a good question. And she is still around. She's just not here today. Just so you know. Certainly when we walked into Dr. Lee's office, she was there with me. And she's probably the one that bought me the little notebook. It's certainly a big part of the decision-making process. She had to feel comfortable sitting there almost as much as I did. Maybe even more, because the communication, it's very important to get good communication between the patient, the caregiver, and the doctor. And I'm happy that we have had that relationship. I tried to explain to my wife exactly what I had discovered through, internet research and looking at clinical trials and things like that and results from those. And kind of get her up to speed so that when we did get to the decision point, which was about a year later, as I mentioned, she was fully engaged in that, understood, kind of the pros and cons, like John mentioned, of some of the different treatments. And so really it was a three-person decision, at least in Dr. Lee's office. I'm sure he had other people that he was talking to as well on his side. But once we were in the office and had to make that decision, it was a three-person decision. And, she helped with, thinking of questions to ask, what other things do we need to ask about? What should she be watching for when we get home after that first treatment, and things like that. So, I think it's a partnership that's important to have along when you do get to that point of making a decision.
What about yourself, John? How was your your family? How did they help you in this process as well? Were they involved in?
Right. Yeah. Very, very similar, to what Bruce said. Mine went one step further because I did clinical trials, and the time commitment and the number of visits that I had to commit to was a lot different. For example, the second trial that I did required me to stay in Houston for the first month of the trial. So that meant me, kind of going away and going to the hospital every day, and my family, was not going to be with me, although my wife was able to join me for, a couple of weeks when I first got started. But a lot of it was, when I was looking for clinical trials was one, is this the best clinical trial for me? Not just is this the best treatment option, but is this the best clinical trial in terms of time commitment, time away from my family? I work full time. So we did also get second opinions on clinical trials. We also went to Dallas and at UT Southwestern, and the great thing about the kidney cancer community is everybody knows each other and they know about the other trials. So it was not just a joint decision with my wife, but also the two other doctors in clinical trials that I saw. But that was a big part of it, and had some factor into our decision on which direction I was going to go, what time commitment that was going to be, and does she have help supporting our son, who was probably 10, 11 at the time, so which was very active. So that weighed a lot into it, and she was very involved with it, very supportive, but also was concerned about what's going to be involved with the clinical trial. Is it going to work, is it not? And a lot of those questions. And I tend to take the dive deep into it approach, kind of like Bruce does, and she's kind of more of a high level person and doesn't want to go get too deep into it, but hey, what's the end factor going to be? What's the commitment going to be, and make the decision from there.
Good. Dr. Lee, how do you approach, also family? I mean, obviously they can be very what do you see as the pros, but also potentially sometimes the difficulties that come with families, extended families, and in the relationship you have with the patient in this shared decision-making journey?
I think family is incredibly important for part of the cancer journey, and understanding who the support network for the patient is and how the decision-making process gets done. I think that having people who are advocates for you, having people there at meetings and visits who can listen to what's being discussed, and in order to, sometimes as the patient, you get the sense that you're so deep into it that it's good to have some external ears to kind of listen and kind of help process and kind of recap everything that was said. I also think that there is, a lot of benefit to having people involved early, especially when you think about children, especially if you have adult age children, letting them understand what's going on. I think that sometimes a lot of patients do try to protect their children a little bit. And it's really at the end in which they see you getting sick when they finally find out what's been happening. And I think that can also be a shock, because they haven't traveled along with that process, their perceptions of what may or may not have been discussed, or how you feel and what the outcomes are, can be a little bit different. Even in terms of the decision about what treatments to do, a lot of that sometimes is also based off of the degree of support you have outside of just yourself, because we worry a lot, if you get very, very sick, but you're all by yourself, then I think that's very, very different from if we know that you have a strong social support network that's there that can kind of catch things. An example would be like if a patient got confused without someone around, the confused patient is not going to be able to communicate that they're confused. Whereas having others around who are aware and taking part in the entire process, is certainly very helpful. So.
Yeah, no, I agree. I think there've actually even been clinical trials that have shown that patients who have a significant other in their lives, actually do live longer and do better. But yeah, it's definitely good. And I think we even have some of our audience members have been messaging us and commenting on that point, saying that, someone said here, my spouse and daughter were present for my diagnosis and treatment plan, and having advocates ensures full understanding is gained. So I think we all agree that it's very helpful having these advocates on our side. So one of the questions that one of the audience members here is asking us is, my urologist and oncologist are both receptive to questions, but I sometimes get conflicting information on things like frequency or dangers of certain tests or treatments. Do you have any suggestions on how to reconcile differences of opinion? Who is there? Anybody would like to start that question and kind of how do you approach when you're getting, I guess, different messages from different team members in your healthcare? Dr. Lee, maybe as a clinician, and we have to
I think
how do you resolve that?
Yeah. So I can tell you that from the clinical perspective, sometimes these differences of opinion, it's not that anyone is, right or wrong in that sort of setting. It's that they come from the problem in question from a different direction. You often can see this between urologists and medical oncologists in terms of when they talk about risk. And I think a lot of it comes from the fact that from the urology side, they've certainly cured a lot more people than the medical oncologists have, to be fully honest. They certainly do a much better job at curing people, at least as of 2021. We're certainly getting a little bit better, but certainly not to where the urologists are. And a lot of what you see is what you see colors the direction in which you give this type of advice. And I think that even when you talk about from medical oncologists, for a person who sees just kidney cancer may actually give you a slightly different perspective than a person who sees all malignancies, even though they're both medical oncologists and, fully qualified to provide treatment and trained to do so. I think that you get a different perspective based off of just in some ways volume and what has happened to other people. I think that in order to reconcile those types of differences, I think where it's useful for the patient is to understand where these opinions are coming from, and trying to understand their perspectives and making sure that their perspective aligns with kind of your situation, and having that type of partnership.
What about from a patient standpoint? How do you reconcile sometimes differing pieces of advice? I know, Bruce, how did you deal with that? Especially, it sounds like early in your diagnosis.
Yeah, so early in my diagnosis, I had a urologist and a medical oncologist, but more of a general, like Dr. Lee said, general oncologist who could treat many different malignancies. And that was, there really wasn't a lot of conflicting information there. It was, the oncologist referred me to the urologist once we confirmed that there was a big tumor on my kidney. The urologist said it had to come out. And then once we finally determined that it was metastatic, the general oncologist said, you really probably need to see a specialist. And he actually, suggested Memorial Sloan Kettering as a, place to go to find such a specialist. Because, and again, he said, I think these are probably the treatments you'd be looking at. And he mentioned immunotherapy, and he mentioned, like IL-2, some of the older historical treatments for kidney cancer, and what the possibilities of success were with those. But he did not feel comfortable treating me at that stage. So he actually, referred me to find a more of a specialist. So that doesn't really answer the question about reconciling differences, but I do think that in the case of these of kidney cancer, there is a strong benefit to finding someone whose role is as a kidney cancer oncologist. I think there's just a strong benefit to having that, just because things are changing so rapidly, which is great. It's a good thing for us, but as patients and doctors. But it's I feel strongly that that's an important thing to do as a patient, is to find that person who really knows. If you have the ability to, because obviously they're not everywhere in the country, or in the world even. But I think that's a very important thing.
How about yourself, John? You also mentioned that you, especially early on, had exposure to lots of different doctors, different opinions. And if they were conflicting, how did you reconcile any differences of opinion, for instance?
Yeah, sure. I think that it felt like that initial diagnosis and initial scans and trying to make that decision. I was bouncing around to the different doctors' offices saying, well, this doctor over here said this and you said this, why? And I think that's the important thing, is to understand the why of that decision, if it does differ from another doctor. And one doctor, suggested the partial nephrectomy. The two others said, take it out completely. So I did go back and ask why. And I also went back to the one of the other doctors that, full nephrectomy, and said, why? And they were able to pull up my scans and show me exactly where the tumor was, and, what, veins and where it was, and it was near my diaphragm. And, they said, this is the why. So it's really understanding, if you have that conflicting information, to just be open and honest and say, hey, I spoke with this doctor or oncologist who may or may not have been a specialist, and gave conflicting information, and trying to get as much of that information as possible so you can make that decision on behalf of yourself. But as Bruce mentioned, it is certainly important to see a specialist if you're able to, that sees these types of scenarios every day, as opposed to someone that may be treating prostate cancer and kidney cancer patients and so forth. So that's why it was important for me to go to a center that had that specialization, but understand that's not always available for everybody. And so it's just important to ask why, so you can make the best decision for yourself.
That actually kind of alludes to the next question that we have from an audience member. Basically, both of you had got your care at premier cancer centers. But, if you're living in a small town and you don't have access to a major cancer center, how do you, how can you get second opinions? What resources are out there for patients? And that's sort of a common question that's coming up. And so maybe you can share, John, can you share your your thoughts, and Bruce as well?
Sure. And KCA is a great resource, right, for everything, as far as Just Diagnose Toolkit, to help you kind of navigate, through the process of what your treatment options or so forth. There's a lot of, online forums, I know Smart Patients, very popular one. Kidney Cancer Association does have a presence on Smart Patients. So you are able to bounce ideas off of other patients and maybe other treatment options. Granted, different treatment options are obviously different for different people, but I have turned to a lot of forums, whether it be Smart Patients or some of the Facebook groups that are out there, just to get information and get a patient perspective, which I think is very important. Also, if you don't have access to major cancer centers, oftentimes these centers, you are able to do a virtual consultation. So you are able to send them your tests. They are able to maybe look at your scans and provide an opinion remotely. My wife, who's a breast cancer survivor, had also a benign meningioma, brain tumor. And, our first thing was to go to MD Anderson. We got that opinion. We also wanted to get other opinions. So she did a virtual consultation with a doctor out in Stanford, and then the Barrows Institute in Phoenix, and did virtual consultations where she was able, and the great thing is this day and age of electronics, you can upload a scan, online, or send them to disc in the mail, and they're able to, do a virtual consultation. So there are some ways to get multiple opinions, even if you are in an environment or rural setting that doesn't necessarily have a major cancer center near you.
Yeah. What about yourself, Bruce? What would you recommend for folks who live maybe in smaller towns who don't feel they have access to a large cancer center?
Yeah, so I'm going to just add on to everything John said. That's exactly the way to approach it. I think Smart Patients is a terrific resource to go on and say, hey, I live in, wherever. I live here. Help me find a specialist. And within a day, you'll have a list of specialists that are actually, you'd be surprised, maybe not that far away, maybe a couple-hour drive. And if not, people say there's a few good things that came out of the COVID pandemic, and telemedicine is one of those. It has really opened up the eyes of not just patients, but clinicians, that, you can do an interactive, video conference telemedicine visit, and it's effective, and you can get a good opinion and good review from another doctor that's 1,000 miles away. So I think there are definitely options, as John said, in today's world, and use your resources to find out where there are other options, and who's willing to do that telemedicine visit as a specialist.
Dr. Lee, as a clinician, how do you, how does that work? Do you interact with other oncologists, local oncologists? How does, for especially for patients who maybe aren't able to come on a regular basis to New York City for their care? How do you see that path working out? How do you, in a practical, what are the logistics for that from your standpoint?
So I think that in medicine in general, a critical thing is for every doctor to kind of know their limits, right? Like to understand not only what they do know, but what they don't know. And I think that that's critical, because there's nothing more dangerous than a person who just doesn't know what they don't know. and is just going to kind of learn on the fly. And I think that even when you think about choosing who you might want as your primary provider, it is sometimes actually worthwhile to ask them things like, how much experience they have with the disease, and even asking them in terms of, what are their go-tos in terms of for tough cases or difficulty. Because everyone has, a network as a physician about like who that they would go to. Like certainly when I have challenging patients or, challenge cases, like I have my own network of people that are like my go-to people for advice that, I will discuss with. In terms of for people who have, who live further away, in which like, having things be logistically feasible is really crucial. Because, it's not just how frequently you have to come in, but also the management of side effects and, how far away you are if, something bad is happening. Like if you're having side effects, if you're having difficulty, how can we safely manage that? A lot of times it's actually, we do a lot of partnerships with, a local oncologist. Like you may see someone closer to home who is able to be the day-to-day sort of like point person. But, when it comes to treatment decision-making times, then, you make follow-up visits to, see, what our thoughts are about in terms of, what sort of changes to therapy should be made, or do we kind of stay the course? Because that's sometimes the harder part. I mean, if things are going great, I often tell patients that if things are going great, like, and you live 2 hours away, it's probably not worth a 2-hour drive for me to tell you things are great and then send you home. And I think that telemedicine has also been quite good for that, for especially people who are doing fine, nothing is happening. It's, we've been able to watch you for a significant amount of time. Like, I understand that there are plenty of things that you'd rather be doing than like sitting in my waiting room. So.
Very good. And I just wanted to dovetail a little bit about the question of, resources and finding resources, and just remind, our viewers that KCA also has a patient navigator program, and the patient liaison, Rosemary, who's a great resource to help patients with finding resources in their area. So just a reminder that to take full advantage of the resources we have here. So we're one of the other questions that we're all, this is obviously you guys are success stories here, but also I wanted to see what are potentially some red flags that you would be want to be aware of. What should patients be be concerned about? Bruce, would you like to kind of take that on? What are the red flags of this relationship, I guess?
I think the relationship with the doctor, if you just start to lose communication or lose feedback, and it becomes a one-way street, that's not the relationship you want, right? If you're just purely focused on trying to communicate well with the doctor, and the doctor is just not having that two-way communication. I don't know if I can think of any other red flags. No response. I mean, most medical facilities now have a patient portal that you can go on and send a question in or something like that, and you get no response. I mean, that's a red flag for that relationship. not including the family in the discussion. We talked about how important that is, and maybe, I think that's been a negative of the COVID experience, right? Because of a lot of hospitals or facilities have restricted who can come in for a visit. That's, actually telemedicine is better that way, because then you can have the spouse right next to you, or the significant other. So, those are just some of the things that I can think of that would be a concern for me if I was a patient in that relationship.
How about yourself, John? Do you have any other thoughts about red flags with?
I'd probably say one of the biggest one is not having a medical team that is open to that shared decision making. That if it's just a one-way conversation, this is what we need to do, and doesn't take the time to listen to your concerns or involve you. You may not know. I've had some doctors that are pretty straightforward like that, and some that do ask questions and try to make sure that you make that informed decision. But that is a big red flag if your doctor is not open to second opinions, if they're not open to potentially co-managing your care, as Dr. Lee mentioned, potentially doing some treatments locally, and then scans and so forth at a major center. So those have all been red flags in the past, and not being able to explain the why if you ask why.
Yeah, no, those are all excellent points. Dr. Lee, do you to the points that they alluded, do you think as clinicians, are there ways that we can, what should we do better? Are there ways that we can rectify these? What should we be? How would you address some of these concerns if patients bring them up to us?
Yeah. So I think that there's two parts to that. One is that, my opinion is that we should feel comfortable with patients asking questions, and for us to be able to deliver answers. I think that's that should be a basic expectation, that you should have with your clinicians. And I feel that if you have someone who's not meeting that at least basic type of criteria, that may not be the greatest person to be seeing. But at the same time, I also think that as physicians, you have to have enough humility to know that you don't know everything, right? So that there is value in getting second opinions, and I certainly hope all of my patients recognize that I don't take offense by them getting a second opinion. A lot of patients, when they get second opinions, they always do this this is some sort of secret clandestine thing that they're doing, and the oncologist is going to take offense by this. From that perspective, you should if you have an oncologist that's going to take an offense by you getting a second opinion, that's probably not a good fit in the first place. I think that you want to have someone who is comfortable having you seek different opinions and having that discussion with you about if it's the same opinion, that's great. If it's different in some sort of way, being able to explain to you why they came to a different decision.
That makes perfect sense. So I think we're I don't know if there's any additional questions from the audience, but I think it'd be good to, I think we can probably start to wind down. And my question, I guess, to each of you is, if you had to leave with one pearl or advice to the folks listening to this, what are your thoughts to what would you like to have a takeaway? Let me see. Maybe John, would you?
Sure. Yeah, I can touch on that. I'd say just from parting words, and as we went through this session, thinking about those folks who may not have that support system is understand that there are a lot of resources out there and a lot of patients willing to help. Like Bruce and I, we're open and honest and more than happy to be a sounding board to anybody and offer our support to anybody that's going through this. I have been fortunate to have a great support system with my family and friends. And if I did not have that, I'm not sure what I would do, but I would certainly know that there are resources and other patients out there willing to help and be those support system for you. So. I think Zita might be locked up. Bruce, do you want to touch on that?
Yeah, sure. So yeah, I think, obviously that's a great one to think about, that there are lots of resources out there. KCA is a terrific resource for, especially if you've just been diagnosed, especially if you just started your journey. There's a ton of information there, including a whole list of questions to ask your doctor. And find a doctor, if you can't find a specialist, at least find an oncologist who will partner with you, who will listen to you, who will help you go through the decision-making process. I think that's what I would leave. Dr. Lee?
Yeah, so I think that the other part that I would add is you really do need to trust your gut on this. I mean, you're making a lot of decisions in a very short amount of time about who you're going to be working with. And these are very important decisions. You want to make sure that, if you feel uncomfortable in any sort of way, that, to listen to yourself for that. And that goes beyond, what institute this person works at, or this goes beyond whatever credentials they have, to make sure that whoever you're building this long-term relationship with is a good fit for you. I really do think is critical.
Very good. I apologize. I had a little bit of technical difficulties just there a moment ago. I think did we everybody?
Yep, all three of us got to talk to you.
You're on mute, Zita.
Sorry there. I apologize. I had some computer difficulties all of a sudden. So again, I just wanted to, I think we finished our session a little bit early. So I just wanted to thank everybody for participating, and I guess we can probably reconvene at the next session, which I believe takes place. I don't know, Sally, if you can pipe in.
Absolutely. No, this I think was a great session, giving patients the idea of sort of how to start those decision-making discussions with their physician. And basically, I do want to remind people, we have seen some questions in the chat that are asking specifically about how should I be treated based on the history that's there. And we have to be very careful. We don't want to give out medical advice. We don't have your full background, but we do definitely encourage you to reach out to your physician, reach out to our patient navigator program, who can get you to some physicians that may be able to offer some opinions on that care with more detail. So it's not that we're ignoring the questions. We just want to be very careful with giving out advice with only having limited medical information. But we are going to move into break now, and we will break until about 11:30 Central Time, where we'll come back with a talk on genetics. I do again want to thank all the panelists today for being part of this discussion. And I want to encourage everybody who is on today, there is a link on the left-hand side of the screen that says Patients Insights Survey. This is a survey where we're trying to figure out what is it that the kidney cancer community really needs. Again, we've talked about this shared decision-making. KCA is in full support of that, both clinically and just in our interactions with patients. We want to know what it is that you're missing out on in your care, information and resources that you think would be helpful in your journey. So you can click on that link there. It'll also pop up on some of the slides during break. It's a short little questionnaire to go in and sort of give us your opinions, completely anonymous. And again, as Dr. Lee, and I know John and Bruce have also mentioned, there's definitely other KCA resources. Some of you have been wondering if those are going to be, things that we could give you right now. And we are actually going to send out after the VPS on Saturday. We'll be sending out a conclusion over the next couple of days with resources and summaries of what we talked about today and those resources you can use to get you some of the help and answers that we've been talking about at these various sessions. So again, we're going to break for about a half hour. So we'll see everybody back here at around 11:30 for a talk on the genetics of renal cell carcinoma. Thanks.
Thank you.